All right. So essentially, this is like the results interpretation document, and it really has a lot of answers to like clinical questions that you're going to get from doctors. And they always try to put you on the spot. So, so I figured I'd take you through it. So
Right.
essentially, most of this stuff we've already talked about all weekend, but then there's a few other things, and I just like learned about the endothelial function, which is really good. But essentially, these right here are like the different measurements it's taking, and then what it's diagnosing. So heart rate variability, you're able to diagnose cardiac autonomic dysfunction and evaluate the fitness of the patient. And all it's measuring is how well the patient's heart rate responds to challenges, right? So, when you do the Valsalva maneuver, how does their heart rate respond? When you stand up, how does your heart rate respond? The cardiac autonomic reflex test, again, you're testing cardiac autonomic neuropathy. Due to motor function, you know what that is. That's testing the sweat response of the feet, and that is going to diagnose small fiber neuropathy. The ankle brachial index, or ABI, is detecting the blood flow in their lower extremities. It's looking for blockage or calcification, and that'll diagnose peripheral artery disease. The pulse oximeter is detecting photoplethysmography, and it's using mathematical analysis of the waveform to analyze vasomotion and the vital signs. And then the blood pressure and arterial stiffness analysis is monitoring and treatment of management of hypertension. So again, you're just monitoring the blood and the nerves to basically diagnose either peripheral artery disease or neuropathy effectively. And they're interrelated because the blood feeds the nerves. And so if you're trying to treat the nerves and you're not looking at the blood flow, then you're not able to treat the entire picture. Obviously, this tells everything that's everybody who's qualified for it. It shows the equipment.
Now, this is a good document.
Yeah, so this one right here talks about why we're assessing vascular dysfunction. And the first sentence is is important. The assessments of autonomic nervous system, endothelial function, ankle brachial index are well recognized tests to detect early complications in diabetic patients. So again, the blood and the nerves are together. Homeostatic regulation is adjusted by two main body networks, autonomic nerves and the endothelial cells. So the endothelial cells are the cells on the walls of your blood vessels and arteries. And your autonomic nerves are the small nerves that maintain your autonomic system. When they're working together, the patient is in good health and can recover from illness. When they're stressed, there's a lot of diseases that can happen. And that's the crux of what we're testing for. That's why they're kind of in coordination with one another. This is a really good chart right here, because it tells what we're testing for, how we test for it, and why. So like this page right here, page 8, I'd read this and learn that chart. And then right here is really, really good, the TM flow outcomes by specialty. So when we saw that endocrinologist, we didn't even talk about target HbA1c. That's something that she would have been really responsive to, right? When we're talking to pain management and neurology, that right there is probably what we talked about with these chiropractors, because they're looking for neuropathy.
Right.
Internal medicine and cardiology, right? So like cardiology.
I think that's great.
Yeah, isn't it cool? These are the markers for autonomic nervous system and how we're testing that. This talks about each, the part of the test where they're blowing on the Valsalva, they're doing deep breathing, they're standing up. This is all about that. So K30-15 ratio, that means their heart rate at 30 seconds and at 15 seconds after standing up. So that's why it detects their heart rate. That's why it takes so long to do this, because it's detecting their heart rate and how it changes. So how fast are they recovering from standing up? Next talks about cardiac autonomic neuropathy. This is probably a good one for the Kairos too. Talks about the nitric oxide peak. This has the suggested treatment.
Yeah. Sweat
So
peak.
a lot of these guys use near infrared light, right? And they charge for it. So this will validate that. Doctor, why are you doing this? Here's why. And then the endothelial, I think that if we all learn these are probably the rarest ones, but they're becoming more mainstream. And so you have insulin resistance, blood flow, prothrombotic, so that's thrombosis, inflammatory, and then vascular tone. So all of these, and these were the markers that that endocrinologist was asking about.
Right.
So these are things that'd be good to learn. They're the most technical, but they're the ones that would probably be good to learn. Page 13.
What was her name again?
Garcia.
Dorothea. I can remember her name.
Yeah. This is all lifestyle. So you have exercise capacity, vital signs, fat mass. I mean, this is really good.
Yeah, it's I'll read through all this whole entire thing and
Yeah.
study each one.
And then it has all of the studies with the links. So
Oh wow.